Hi, I'm Michelle and I'm a pregnancy and postpartum corrective exercise specialist, and I wanted to share with you the considerations you might want to be aware of during your first trimester when it comes to exercise. Plus, you'll be mastering the basics of Kegels and breathing, as well as learning about the early signs of preeclampsia. Number 1, fatigue. Firstly, you may be suffering from extreme fatigue in that first trimester. I certainly did. My advice would be to try to not stop completely, but just try to decrease the volume while still retaining some strength. It doesn't have to be an all or nothing approach. Something is most definitely better than nothing. To do this, you can decrease the number of sessions you do, reduce the steps and reps and the weight that you are lifting. Number 2, nutrition. Please eat. Some women have a really tough time with body image because they feel like they're gaining weight and they don't look pregnant. Give yourself a break. You are growing a human in your body, and adding a little weight is completely normal. Eat healthy foods and foods that you can keep down. I found little and often was the best for me. Number 3, emotions. Being pregnant is really emotional. I want to reassure you that if you miss a workout or even a week due to tiredness, then it's okay. The second trimester is much easier and less tiring for most women. Number 4, the basics. Firstly, we're going to start with 360 breathing, but it's important to note that during your pregnancy, expansion is decreased due to the baby pushing up, and we want to promote this breathing for as long as we possibly can. 360 breathing is a deep breathing pattern, and it involves the expansion of the front, the back and the sides, and moves with your diaphragm. So I want you to take an inhale through your nose and an exhale through your mouth. I'm going to demonstrate with the ball. Imagine this ball being your rib cage. So inhale through the mouth and you're going to take that breath into the body. Expansion of the sides, the back and the front, and imagine that air coming down to meet your pelvic floor. Exhale, inhale, exhale. Amazing. Okay, so now we're going to incorporate our pelvic floor, because this is the whole point we're doing this. We want to learn to release and relax and contract that pelvic floor. Okay, so imagine as you inhale, you are going to keep that pelvic floor relaxed. It's going to be just, chilling out and not doing much. But important, do not bear down. No pushing down. And then when you exhale, I want you to lift and squeeze that pelvic floor. So if you don't quite know how to do a Kegel, let's first of all sit on a pillow. It will help you, I promise. So take your pillow, place it between your legs and relax. So imagine the pelvic floor is a house, and we've got a basement level, we've got a ground floor, and we've got a first floor. The first floor is where you want to lift it to, and the basement is where you want to be relaxed. So if you sit on this pillow, sometimes we find it easier to connect with the pelvic floor and release it down to basement because there's something there for us to work towards. Now, don't bear down. Bearing down is like pushing for a poo or a wee. Please don't do that. Just let it relax. Okay, little wiggle if necessary. So on the inhale, we are going to release that pelvic floor. Ready? So inhale through the nose. Expansion, sides, back and front, releasing pelvic floor tension. As we exhale, I want you to let that body come in, and I want you to squeeze to the ground and then lift to the first floor. Ready? Inhale, exhale, ground, first. Inhale, releasing back down to basement, completely relaxed. Exhale, squeeze the ground, lift first. Back down and relax. Good. Okay, so You remember not to bear down, it's super important. Have a pillow here so that you can try to connect that mind to muscle. And remember, practice makes perfect. Number 5, think long term. As you get further along in your pregnancy, you may need to adjust your workouts, and this can be difficult mentally, especially if you are used to pushing yourself. Remember, it's just a period of time. You can still move, which will aid your birth, making it easier and your recovery much easier too. Number 6, caution. If you feel any of the following: dizziness, feeling faint, shortness of breath, decreased fetal movement, extreme fatigue, pain, or even elevated blood pressure, you need to stop and seek medical advice. Number 7, complete contradictions to exercise. These may vary, but if you have been advised by your medical practitioner not to exercise, then please listen to them. Watch out for preeclampsia. This affects about 10% of pregnant women, usually in the second half of their pregnancy. Early signs of preeclampsia include high blood pressure and protein in the urine. Everybody's blood pressure will be slightly different. Ideally, your blood pressure shouldn't be higher than 120/80. If you notice any of these symptoms of preeclampsia, seek medical advice urgently. I hope this was helpful to you. If you liked it, please give it a thumbs up and subscribe so you don't miss any of my workouts or advice.